Uh, Greetings. We continue our working day. The topic of the next press conference is epidemiological situation. Our speakers are the acting head of the State Sanitary Epidemiological Service of Ukraine and the head of Ukrainian Center, Svyatoslav Protas and Rodyna. Good afternoon, esteemed representatives of mass media, esteemed citizens of Ukraine. We are with a pleasant mission today. We would like to inform you on official completion of the epidemics of the flu in Ukraine and the grounds for that is the analysis of morbidity in during the last week, and we see that not in a single region of Ukraine the threshold level of morbidity does not exceed the limits. In some territories, there are 36 administrative rayons in 6 cities. There are some big levels of the disease. There are 56 educational institutions where the educational process has been suspended. You see on the monitor the green map of our country. That is not because the winter, the spring is coming closer, but that is the real picture, realistic picture. Here you see the dynamic of the epidemic season. You see that during 4 weeks the epidemics lasted in our state, which unfortunately took away the lives of 329 people. That is the official information. The analysis of the reasons of such high death rate just shows that people do not care about their health. All the lethal cases, these are the citizens who had no inoculation against flu, who came late for medical assistance. Having analyzed the situation that we had during the epidemic, last week we made a decision during this year to do mandatory prevention inoculations against flu for people of high risk of the groups of so-called medical epidemiological risk, and such groups include the persons with high level of clinical complications. These are people with clinical diseases of different clinical diseases, chronic diseases. These are people who are above 60, pregnant women, and first of all, those who work in medical sector, in educational sector, trade and transportation.
Цю категорію населення.
And we will be directing our efforts at this category of people. We will be increasing the volumes of vaccinations, because we every year we manage to provide to vaccinate less than 1%. In other countries it's more than 30%. Our objective is especially people of elderly age. We want to at least make vaccines for at least 75% of the population. The analysis of the situation this year shows that our citizens have become more civilized. If we compare that to 2009, elections were coordinated at the central and local levels of authorities, and I would like to thank you all on behalf of all medical sector. I would like to thank all the medical workers who have been working 24 hours, 7 days a week. And these are those who worked in the hospitals, in sanitary laboratories to diagnose the disease, to provide high-quality medical assistance. We hope that our actions and our decisions about vaccination will help us avoid so-called second wave of increase of the disease, which takes place every time, which happens every time, and we are planning to seriously reduce the level of morbidity in the next season. And on specific features and on the forecasts as to the next season, Roman will tell you about that, and he's the representative of Ukrainian Center for Control and Monitoring, the Ministry of Healthcare of Ukraine, talking about the monitoring which has been conducted by Sanitary Epidemiological Service and by Ukrainian Flu Center. We can say that in this pandemic flu H1N1 was prevailing. That is what caused pandemic in 2009. Now, the experts are researching whether this virus muted compared to 2009, analyzing the morbidity in European countries, in Western and Eastern Europe, according to the WHO data. We would like to mention that this process was different from the previous years. If in the previous years that process was moving from the west to the east, this year it was moving from the east to the west. And that is how we can explain why Ukraine was one of the first ones to register high level of morbidity and death rate from flu. 82% of those who died, they died because of H1N1 flu. According to the data of WHO, the similar situation was observed in European countries. The epidemic started a little bit later there than in this country. That was the beginning of January. And it also lasted for 4 or 5 weeks. And similar to our situation, H1N1 flu prevailed. The similar situation is with the death rate. But WHO experts say that in the Western Europe, the B group virus was prevailing. H3N2 was characteristic for Turkey. In Europe and in Ukraine, the situation was very similar. Mostly adult people had this flu. As to vaccination, the level of vaccination in the countries of Eastern Europe and in Ukraine and Russian Federation and post-Soviet countries is very different. Not in every country they have the system as to monitoring the results of the vaccination. and in the context of the development of public health in Ukraine, this will be the priority direction for our country. To announce vaccination and then to monitor the results is important. To monitor how the immunity changes in time. That is what we can do. As to the forecast. The forecast for this epidemic season is the first wave is over. We do not exclude, and WHO experts do not exclude the possibility of the second wave. So this vaccination is really something that needs to be done. If we are talking about prevention, the only way of prevention, and that is what is confirmed by the World Health Organization, is vaccination. That is why the instruction of the chief sanitary doctor was issued, and that is not just for this epidemic period, but for the epidemic period which will take place in the end of 2016. And I also would like to thank you, the representatives of mass media, for explaining to the population about the necessity of prevention of the flu, for disseminating this information, because only if we increase the awareness, we will be able to influence the situation in general in the country. Thank you for attention. Thank you, Roman. Thank you, Svyatoslav. In the end, I would like to say a few words more. I would like to remind the citizens of Ukraine, the representatives of mass media, that the flu is an infection which could be prevented, and you have to try and prevent it. And that is what I would like to draw your attention to. I would like to remind that the flu does not disappear, and during the whole year it is here in the environment. Just the level of the morbidity is low between the seasons, but it's easier to prevent the disease than to treat it. You need to be very careful all year round, following the recommendations which you can see on the monitor. Now let's move to questions. Channel 5, you said that you're planning to provide vaccines for the elderly people, for 75% of the people. For the groups of risk, this is something mandatory. We need to vaccinate the local authorities, the employees have to provide vaccines. We made a decision to continue this process all year round, so that all the everyone has the possibility to plan the process, so that the preparations are bought, the groups of risks are to be identified. Any other questions? 1+1 TSN. When can we start getting vaccines? Who should be paying for that? Will it be free of charge for a person? It's never late to get vaccine. everyone should decide whether you want to protect yourself today or the next year. The WHO you need to disseminate the myth that you have that during the epidemic season you cannot get vaccination. This should be done before vaccination, and after that you need to monitor your condition, not to do that when you need to do that when there are no signs of the disease. The immunity from the flu starts developing 5th day after vaccination, the highest level, that it gets the most number of antibodies on the 3rd and 4th week of vaccination, and it's there for the whole year. Who's paying for the vaccination according to our legislation? And heads of the organizations, of the companies have to provide such vaccination. That is important for the workers of medicine, of education. The local authorities have to provide that, as to just other sections of the population. They define the risks themselves and they have to get vaccines, paying for that. How much does it cost? The sanitary epidemiological service doesn't sell vaccines from 100 to 200 grivnas. Should people go to the therapist and say we want to get vaccination? Those who want, they can do it themselves. Where it's decided in the organized way, this should be done according to the plan. And the first wave is over, but you said that the second one will be. We were expecting for the second one. I didn't tell you that it will take place mandatory, but to avoid it, we need to get vaccinated. Thank you. Any other questions or clarifications? Thank you, speakers. See you.
Колеги, ми на цьому завершимо прес-конференцію, і наступна прес-подія о 2-й годині.